Okay. Hello, everybody. Dr. Rafich here, Vet Triage. It's Wednesday, November 6, 2024. And let's see, 12:18 p.m. Pacific time. You'll notice a different background. I'm in a hotel lounge waiting for my room to get ready while I'm here in San Diego for a high school career day event. Okay. We are still going through this issue of JAVMA. It is May 15, 2018 issue. And we are looking at the evaluation of the diagnostic utility of cytological examination of renal fine needle aspirates from dogs and the use of ultrasonographic features to inform cytologic diagnosis. All right. So the objective is to compare the cytological characteristics of kidney fine needle aspirates, or FNAs, from dogs and compare those to the characteristics of kidneys based on ultrasound and see whether or not the imaging and ultrasound can dictate cytology. Results showed that 72% of specimens had slides that were adequate for interpretation by a board-certified clinical pathologist. The sensitivity of the cytological examinations was 78% for detecting cancer. The sensitivity of cytology for detecting non-cancerous disease is 50%. Specificities for diagnosing cancer is 50% and 77% specificity for non-cancer. The sensitivity for detection of lymphoma is 100%. Ultrasounds showing masses were often linked with carcinoma. That's the most common, followed by lymphoma, and then other types of cancers. You did not see kidney masses if they did not have cancer. So very simple, very important information. Let's go into the background. Renal disease in dogs is most frequently evaluated by serum biochemistry analysis, so the chem panel, and urinalysis, or the UA, and ultrasound, depending on the clinician and what the blood work and urine shows. Histologic examination is the standard for diagnosing solid tissues like the kidneys. There's a risk of bleeding when you try to biopsy the kidneys, and in people, hemostatic derangements have been noted during ultrasound-guided kidney biopsies. And so they worry that dogs and cats may have even a higher risk of bleeding disorders from kidney disease, more so than even liver biopsies. And this may be related to a uremic thrombocytopenia. So uremic meaning that it's related to the toxins that build up with uremia. So that's towards like end-stage kidney disease. And then thrombocytopenia means the platelets that form the initial clot in the vessels, they are not functioning well. You have normal number of platelets, but they're not functioning well. But also anemia could be a cause of hemorrhage, plus concurrent systemic hypertension, high blood pressure, which is frequently found with kidney disease. Complications of kidney biopsy by ultrasound is higher in dogs that have low platelet counts. Kidney biopsy complications has been reported in 13% of dogs with predominantly non-neoplastic kidney disease, with severe hemorrhage being the most common of the complications. And the potential for the kidney biopsy to affect kidney function is also a concern. Cytological examination of kidney FNA samples might be useful for lymphoma, carcinoma, metastatic neoplasia, cysts, and fungal infections. And this is for kidneys that are either enlarged or have a mass associated with them. Renal FNA samples are unlikely to contribute diagnostically useful information for congenital or hereditary abnormalities and inflammatory conditions, vascular abnormalities, especially if the kidneys are small. With regard to materials and methods for this study, they looked at cases between 2005 and 2014. They determined that if there were over 80% neutrophils, that was considered suppurative. If it was less than 80%, it was considered non-suppurative, meaning it was mixed inflammatory cells. Neoplasia was subclassified as either round, epithelial, mesenchymal, neuroendocrine, or an anaplastic. And that's good for anybody, for vet students especially, to know the different categories of neoplasia. Then malignancy characteristics were examples of anisocytosis, anisokaryosis, variable nucleus to cytoplasm ratio, cells with multiple nucleoli, and bizarre mitotic figures. Now, from the ultrasound, they collected their samples using a 22 gauge, 1.5 inch long needle or spinal needle, and they did use color Doppler imaging to assess hemorrhage before and after. All right. Results. So regarding the study population, they had 100 dogs with 102 samples. The breeds, most common, Labrador Retrievers, followed by Golden, followed by German Shepherd. Most were male. As far as the ultrasound findings, 95 of the 100 dogs had ultrasound findings. Left kidney was sampled significantly more frequently than the right kidney. That may have to do with like whether the ultrasonographer is right or left-handed. So maybe if they're right-handed, it's easier for them to aspirate with the left hand, or rather access the left kidney. But also the right kidney is located more cranially in the abdomen, so it's tucked underneath the rib cage. So it's a little bit harder to get to compared to the left kidney. But I'm just guessing. They don't mention that. They don't expand into that reasoning here. The most commonly identified features on ultrasound were clear corticomedullary interface, a mass lesion of any echogenicity, and hyperechogenicity of the cortex relative to the spleen. The overall proportion of specimens with slides adequate for cytological diagnosis, meaning diagnostic yield, was 73%. The highest diagnostic yield was found in kidneys with unclear corticomedullary distinction, 90% yield, pelvic dilation, 90%, and infiltrative or nodular appearance, 86%. Now, in terms of cytological findings, specimens were typically of either moderate or severe cellularity. Moderate, 35%, severe, 32%. They found mild to moderate hemorrhage as indicated by erythrophagocytosis. Erythrophagocytosis means erythro was red blood cells. Phagocytosis is the cells are ingesting something. So if the cells are ingesting red blood cells on the cytology, that means the hemorrhage was already there because the body's already reacting to it. The hemorrhage was not there because of the act of collecting the cytology sample. So they found either erythrophagocytosis, hemosiderin, or hematoidin. And that was in 15% of cases that there was hemorrhage. Background material was uncommonly seen, but most often was necrotic debris at 12%, proteinaceous fluid 11%, ultrasound gel in 8%, and cholesterol crystals in 1%. Renal tubular epithelial cells were seen in 65% and classified as mild in 26% and moderate in 34%. There were no glomeruli observed. And that's interesting because with kidney biopsies, I think a lot of times the internal medicine doctors will consider the biopsy adequate for interpretation based on how high the number of glomeruli are. So that's a key factor with kidney biopsies as far as I can recall from school. So it's interesting that there's no glomeruli present on cytology, which would mean, and they didn't comment on this in the paper, if you're looking for glomerular disease specifically, like protein-losing nephropathy, for example, which is very common, cytology may not help you. 19 specimens were from 17 dogs with lymphoma. Sarcoma was second, anaplastic malignancy third, round cell tumor last. The remaining specimens showed renal tubular hyperplasia, followed by inflammation, then necrosis, then hemorrhage, then renal cyst, and 8 dogs did not have any cytological abnormalities. Now, as far as diagnostic accuracy of cytological examinations, the specimens evaluated histologically were collected between 48 hours and 3 years before or after the time of FNA, with most collected within 2 weeks of FNA. So you're going to use the biopsy as the gold standard when you're comparing to cytology. 6 of the 9 cases with sufficient DNA were diagnosed with lymphoma based on PARR. It's an acronym that escapes me what it means, but PARR they use to assess the clonicity of cells, lymphocytes. So typically with cancer essentially is cloning the cells uncontrollably, and so PARR looks for clonality. Okay, so they have a chart here. You see where I drew the lines there, looking at the sensitivity, specificity, positive predictive value, negative predictive value of cytology for cancer and non-cancer. So overall, the neoplasia, sensitivity 78%, specificity 50%, positive predictive value 78%, negative at 50%. Lymphoma was 100% sensitivity, 89% specificity, 80% PPV, 100% NPV. Carcinoma, 67% sensitivity, 90% specificity, 67% PPV, and 90% NPV. Non-neoplastic, 50% sensitivity, 77 specificity, 29 PPV, 89 NPV. And then for those who care about cytology, you can pause it here and look at the underlined definitions there. But I'll try to read it, I guess, like this. So if you look at A is normal to mild hyperplastic renal tubular epithelium. B and C is atypical. Hi there. Is atypical renal tubular epithelial cells with false positive diagnosis of carcinoma. And then for D through F, they show cancer of carcinoma cells. Oh, thank you.
I think it's close enough.
Oh, thank you very much. That's very nice. Thank you. Great. Have a great day. Thanks.
You too. Carcinoma?
Thank you.
You're done now.
Wow. Cured? Done? Congratulations.
Thank you.
Oh, good for you. Thank you. So now we look at the renal ultrasonography characteristics by histologic diagnosis. All histologically confirmed carcinomas that were evaluated ultrasonography had mass identified, where no mass was found in non-neoplastic disease. That's huge. That's huge. Because typically when you see a mass anywhere in the body, you're thinking cancer, granuloma, hematoma, or abscess. Those are your options. And so if we're seeing kidney masses, I mean, the chance of having cancer goes up. Now, there's a small number of dogs. We need larger studies, but that's very interesting. Cortical, medullary, or overall renal echogenicity appear to be of little value in distinguishing among the various neoplastic diseases in the absence of focal lesions. Discussion. Overall proportion of cytological preparations of renal FNA samples deemed adequate were 73%. Other tissues, including 83% for non-mammary cutaneous and subcutaneous lesions in dogs and cats, 73% accuracy for lymph node specimens in dogs, 73% for pancreatic in dogs. Another study showed that ultrasonographic characteristics of renal lymphoma in dogs found that 7 of 9 were adequate. So cytology is pretty high accuracy, depending regardless of the organ. Ultrasonographic identification of focal or multifocal lesions was associated with the highest diagnostic yields, whereas alterations in corticomedullary clarity or relative medullary echogenicity resulted in the lowest yields. Another report suggested that one of the limitations of renal cytology is a high likelihood of samples have low cellularity, but in the present study, 84% had moderate to severe cellularity. And then PAR was used in 44% of the specimens, and for those 44% of specimens, it was considered non-diagnostic owing to insufficient retrieval of DNA. The quality and yield of DNA for human cytological examples include overall sample cellularity, the fixative and stain types, and the slide type, as well as storage time. And there are some tissue-specific variables as to why you wouldn't have enough DNA to perform your PAR test. And PAR, for those who want to look it up, is PARR. Renal lymphoma identified pilectasia, so dilation of the renal pelvis, in all dogs, loss of corticomedullary distinction in 9 dogs, big kidneys in 8, renal deformity and hypoechoic lesions in 6, bilateral lesions were identified in 9 of the dogs. In the present study, a clear corticomedullary interface was frequently present with any of the proven neoplasms, but the presence of bilateral masses, regardless of echogenicity, was almost twice as common in kidneys with lymphoma as in those with other neoplastic diseases. And we've always thought, both dogs and cats, bilateral renomegaly, lymphoma for cancer is number 1 on your list because it's usually bilateral. One study showed that carcinoma was most common for kidneys, for kidney cancer in dogs, followed by sarcoma, then nephroblastoma. Primary renal cancer is rare. Carcinoma is the most common type. And then finally, the diagnosis of renal carcinoma by cytologic examination alone can be challenging. The histopath features of renal carcinoma can be quite variable in regard to cellular pleomorphism, with only mitotic index being identified as prognostic in one study. It is difficult to distinguish carcinoma from adenomas on the basis of cytology alone. We also observed that renal ultrasound, when combined with cytology, may aid in distinguishing carcinoma from reactive epithelial hyperplasia. Carcinoma was the most frequently shown diagnosis for cancer, especially if the lesion was unilateral and hyperechoic. So that's it. Very useful study, super interesting. And we met a carcinoma survivor today. So that's pretty wild. We'll be back again tomorrow. Thanks everybody for coping with this room, and we'll see you tomorrow. Bye-bye.